Welcome to the Wellness Watch, sponsored by the African American Wellness Project, hosted by Dr. Renee Matthews. Today begins our disease series on asthma. Breathe free.
Welcome to Breathe Free, presented by the African American Wellness Project. I'm Dr. Renee, and this is a series about something that is stealing breath from our communities every single day. I'm joined by my co-host, allergist and asthma specialist, Dr. Michael Lenore.
Well, thank you for inviting me again as a partner in this discussion. What we're trying to do is to give you a course in how asthma impacts the Black community in 2026. It's a series of discussions about asthma. And at the end of these discussions, we want you, those of you with asthma, with children with asthma, with friends with asthma, to be more knowledgeable than the doctors that you see. That's our objective. So what are we talking about today?
Why Black Americans have worse outcomes when it comes to asthma.
Well, that's a big subject, isn't it?
Yeah. So can you first come with the statistics that highlight the disparity in asthma prevalence, hospitalization, and mortality rates between Black Americans and white Americans?
Yes, I can say without question that African Americans are in the emergency room more, hospitalized more, and die more often. A Black child is 33% more likely to die from asthma than a white child. And that doesn't speak to what we call morbidity, the number of office visits and doctor visits that African Americans have. Paradoxically, they see the doctor more often, but the outcomes are worse.
So how do historical housing policies such as redlining directly correlate with modern geographical pockets of severe asthma?
Well, there have been several studies. In fact, we did a study here in San Francisco in which we measure the impact of asthma and its distance from clear pollution, which is probably freeways. Now I'm much clearer that it's those environmental toxins that trigger more asthma in any community, but certainly in Black communities that are located traditionally in those areas where you have these problems.
Yeah, so what are social determinants of health and how do they drive the asthma gap in minority communities?
Yeah, probably many of you have heard of social determinants.
Yep.
And what they
Very
say,
common word these days.
and it's kind of a tricky solution because, and I'll tell you why at the end of this, but there are a lot of things that contribute to chronic disease. It's not just the disease itself. It's not just the physician itself or the treatment. Yeah, it's a lot of things in the environment and about not just the physical environment, but the conceptual environment in which many African Americans live. Can you get proper diets? It's can you get access to a doctor? It's can you get transportation to the hospital? It's do you know the medicines that you have? How can we fix our environments? So it's environmental, it's structural in terms of the barriers that Black people meet when they enter the healthcare system, if they can. Often when they do enter it, they're victimized by both physician unconscious bias and institutional unconscious bias. So all these dynamics, without question, contribute to how sick a person is. Not just the disease, but those other 6 or 7 things that we talked about that surround them.
So in what ways does implicit bias in the healthcare system affect the diagnosis, treatment, and trust of Black patients with asthma?
I think this is one of the most important things that we in the African American Wellness Project have discussed with our audience through the years, is that when you enter the healthcare system as a Black person, you can be the CEO of a big company, you can be another doctor, you can be running, you can be without insurance, you're not going to be treated the same. It can start at the desk with disrespect. It can go back to the doctor who sees you as a Black patient and say, well, I got to see this one so I can get to my more important patients. It's certainly not the same. You don't get the same discussions. You don't get the same treatment. And if you think you do, you're absolutely wrong.
Right.
Your position protects you, either as a doctor or as a banker or as a lawyer or somebody really important. If you're Black, you have the same outcomes as all Black people have when they go into the system. Now, the reason we say that is this. If you look at the studies on chronic disease, let's just take prostate cancer, for instance, and we'll swar way back to asthma. And you take 2 sets of patients, one all Black and one all white. And this has been done in a number of different diseases. And you treat them exactly the same. in terms of prevention, early detection, disease intervention, and medicines that are appropriate, African Americans often do better. So it's not a racial thing. And an important fact, and we can get into a discussion on this, race is no longer used as a major parameter in looking at certain diseases. But if you're Black and self-identified as Black, then when you go into these systems, it's just you're not going to get the same treatment. And it starts early in medical school when they bring out those patients that you see in your sophomore year. They're usually Black patients who no money, living bad, drug addicts, and so that forms in the mind of a lot of doctors who are not from our culture that
Mhm.
that's who Black people are, and that they don't want explanation. They don't need the same diseases. They can take more pain. In the area of asthma, there's no question that the diseases, that the explanations given to the patients I see in consultation for asthma are elementary and behind the times. Some instances almost delayed to the third or fourth grade level. The doctors don't always know what they think about asthma. They don't know about the changes in the pathophysiology, where we start to talk about the impact as opposed to control. And like I say, sometimes they'll give you nine short-acting beta and then send you on your way. Because you're Black, you don't really need to have the latest this or that in any of the chronic diseases, and that's often true about asthma. That's why you have to listen to this series, because we want you to know at the end of the series more than that doctor knows. So when you go in there, just a conversation you have with him will change the mind of a physician who has certain preconceived notions about Black people.
So, how does unequal access to primary care physicians and asthma specialists force the reliance on emergency room visits for asthma exacerbations, also urgent cares as well?
Well, because you don't have a doctor doesn't mean that you don't take care of yourself. So in
Right.
some way, some people depend on home remedies. Some people grab the albuterol they've had all their lives and just use it until they just can't use it anymore and be healthy. And so consequently, people learn to take care of themselves, in different ways. I mean, growing up, my mother used castor oil and Ben Gay for everything. I mean, I could have had meningitis. I was going to get castor oil and Ben Gay. And so consequently, patients with asthma, because it's a chronic disease, it has exacerbations, attacks and non-attacks, and periods where they're healthy. Sometimes they just wait until they're sick and they do what they've always done. And the other problem is when they come into the system, they don't feel welcome all the time. They don't feel that anybody's invested in their problem, so why go back? And so consequently, you see a lot of African Americans wait until it's too late. And not just African Americans, a lot of Americans, because the system now is going to boil down where everybody's feeling this.
Right.
But, when you go into the hospital because you have been treating yourself for a long time and the asthma is far along, and just like any other chronic disease, the earlier you detect it, the earlier you intervene, appropriately, the better you will do. So we end up in the emergency room. That's the only option we have in many instances in many communities.
Yeah, but it also, I think that what I discovered in research was that many of us, because we don't have primary care doctors, asthma is just not being treated at all or correctly. So, if you go to the ER and they just write you a prescription for albuterol, it's not treating the actual problem. That's a temporary fix. So it's why it's beneficial, and that's why it's unequal. It's beneficial that you have somebody you go to regularly, so then they know your history and you're not repeating it every time, because when you repeat it every time, you may not remember everything every single time. So I think that's why it's important.
And we'll talk about this in detail. There are a number of tests that you can take at home. I mean, there's the ACT test, which looks at control, the ARQ test, which looks at impact. And you can get a bunch of those tests, copy them if you have to, and every week check the test. But remember, if the control test may be okay, but the impact test may not. So I'm thinking that eventually, I believe, even though I had a lot to do with the ACT test, that the AirQ test will replace that. But you can get those tests, put them on your desk, take them about once a week. It tells you where you are, and then you can go to your doctor with some substantive information. And that's what I think can help change the dynamic.
What role do financial barriers, such as high costs of maintenance inhalers and insurance coverage gaps, play in driving worse outcomes?
Oh, it's all the rage now. I
Right.
mean, these prices have gone up so dramatically. And don't believe your doctor knows how much you're spending on medicine. He doesn't. He just prescribes things, and we don't often know how much these drugs cost. And so, consequently, I think that not being able to afford the doctor, having to decide between paying the copay and getting food for the family, because you can't get much food with the money that's left with the copay.
Right.
You got more in copay money to go to the grocery store now. But because you don't have insurance, or you have to pay, you avoid the doctor visits. And if you're going to avoid the doctor visits, I think that's not a good idea, as long as they're spread out appropriately. But I think having some of these tests we just talked about, and we'll talk about in the future, have a big place in that particular aspect of asthma management.
It's unfortunate, but it's like you said, it's not even just a Black problem anymore. This is across the country that everyone's having issues with insurance nowadays. How do community-based health initiatives and trusted local advocates help bridge the gap in asthma education and care?
Well,
That's us.
yeah, I think, here again, community initiatives require resources, and those resources have dwindled dramatically.
Mm-hmm.
If you put together a community initiative and you wait for a community initiative to help you with your asthma, I think it's important that they exist. But what I'm telling you, and what we're telling you throughout this series, is that you need to know more about it than anybody else. And if there's a community initiative and you think can do something about the social determinants, or increase the number of physicians in your community, or increase your access to specialists, I'm all for it. But at the same time, I believe that health begins at home. I don't believe the healthcare system can take care of you from the top down. You have to take care of yourself from the bottom up. And so consequently, I do like initiatives. I think they've been very important in identifying some of the problems, but not in the detail we're talking about here. I think that if you have asthma, your family has asthma, you friends with asthma, and you need to know more about it than anybody else. And that's what we're going to try to accomplish with our Breathe Easy series.
What environmental justice factors disproportionately impact Black Americans' lung health? So we talked about the proximity to the highways, but there's other things. Unfortunately, the dander from roaches. Then, of course, we have these old buildings with asbestos. I mean, there's a lot of things.
No, you're right. You're right. I mean, you could expand on that. I think that we think about the freeways, obviously, but there's something called environmental justice, where African Americans tend to live close to the dumps and to places where people are living in substandard conditions. And so consequently, we've demonstrated these environmental toxins have as much to do with asthma and maybe more than some of the other things that we talk about. Talk about grasses and trees and house dust and dog and cat. But these environmental triggers, I think they may be much more substantive and important in triggering asthma. So if you're living near a highway, or if you're living near a dump, obviously sometimes we have no choice. But just remember that these are very potent stimulus of asthma, and you should probably do something about making certain that you have the necessary control of your asthma, the necessary understanding of its impact, a doctor that knows what to do and knows more about what to do, because you're looking at this series and we're giving you the information that he may not have.
Why is it clinically inaccurate to attribute the asthma gap purely to genetic differences across racial groups?
Well, race is pretty tricky in terms of disease. In fact, we did the original studies here that were published in the New England Journal several years ago, in which we took 300 self-described Black families. And we did the genetics, and we did the clinical stuff, looked at the social determinants. You can't look at a Black person and tell what part of him is white, Indian, or Black, or African. You just can't. I mean, some of the people that you thought may have been African had a tremendous percentage of Caucasian blood. In fact, my grandfather was a Chickahominy Indian, and my grandmother was Black. And on my father's side, his mother was Cherokee from the Sand Creek March, and her husband was black. When I got my DNA, it's mostly detectable. It's mostly from Finland because you can't trace Indian DNA. It's just not possible. When I get stuff on Ancestry, it's from Finns. They want me to come home to Helsinki, so you really can't tell. And so if you throw a drug into someone and they don't respond or do respond, you can't really tell what race is the part of the genetics that's responding. It seems that in most instances, blacks and whites have very similar responses to treatment. And if you take, as I said in another previous study, that if you take blacks with a certain disease and whites certain disease, and they're treated the same way all the way through, then you're more likely than not to have blacks do better in many instances. So race is, in many universities and many serious studies, is no longer a parameter. It's a social construct.
So what systemic policy changes are needed to achieve true equity in asthma care and outcomes?
I think that, I'm a pessimist about that. I don't think everything I've seen, from civil rights to health, vaccination advice, suggests that you have to understand it yourself. And if you don't understand it for yourself and your family and your community, nobody else is going to help you do that. I mean, some of the stuff that's coming out of Washington now is just ridiculous. And you even know it's ridiculous. But I have seen, even in the state of California, for instance, where you have to be vaccinated. Parents are trying to wait to 9 months or 12 months because they believe somehow there's going to be some relief from the edict that we have here in California. And so consequently, my feeling is, look, don't wait for that. And you educate yourself and educate your family. And in future discussions on our Asthma Breathe Easier series, then you're going to find more and more information. And at the end of this thing, I keep saying it, I want you to know more than your doctor.
And I'm optimist. And so I feel like if we can educate the masses starting from the beginning, we need to educate children so that they're not raised with these thoughts. But especially in medical school, if we can have classes so that there isn't the implicit bias, then I think that there's a way that we can kind of get true equity. We have a lot of allies. Let's like I said, let's be optimistic.
I'm not a need to. I'm a have to person. I don't believe it's going to happen. Unless the Black community takes control of some of these chronic problems. Mm-hmm. And that's going to be a while that the individual must know about his condition and how to manage it. And asthma is one of those things where you can know. Now, if I have a neuroglioblastoma or some other major medical issue, some kind of complicated metabolic problem, Alzheimer's or one of those, that's a little different. But here's a situation where you can know as much about this disease. And the more you know about it, the better you will be able to understand the importance of the things that you're doing or not doing that's contributing to the problem. In the last 3 years, I think I've had maybe 3 patients that been into the hospital, and I probably have the largest population of underserved asthmatics in this area because we have certain things that we try to empower them. And sometimes they bring me articles that they've seen. So I'm hopeful that what you say may become true. But I am a have to person, not a might do or might have or might happen. So I want the Black individuals to take advantage of the information we have and use it to their best advantage.
Definitely. Thank you, Dr. Lenore. I think this was a really great discussion. And please stay tuned. Our next episode, we're diagnosing asthma correctly using AirQ, spirometry, and pheno.
Well, thank you for having me. And as we always say here at the African American Wellness Project, health is your biggest asset, so protect it.